Issue: mercury amalgam dental fillings. Any number of investigations have been mounted into the risks involved in using the toxic element. None have been conclusive. Global's health specialist Linda Boyle has this special report.
The dentist chair can be a place to be feared. There's the drill, the needle, and perhaps even the filling material itself, mercury amalgam.
The reports I've seen have all identified problems. None of the ones I've seen have indicated that it's a wholly safe or acceptable material.
Mercury is poison. A tablespoon of it in a lake the size of a football field renders fish unsafe to eat. Low levels of mercury are associated with neurological disorders, mood swings, and immune system deficiency. But no health study has been done specifically on fillings. Research does show mercury vapor is released by fillings and absorbed into body tissue. And for Mark Richardson, who recently researched the issue for Health Canada, that's enough to recommend limits to mercury fillings of 4 in adults, 3 in teenagers, 1 in children.
There is ample evidence that some action should be taken, if not to eliminate it, certainly to start phasing it out in some way.
A committee of dentists, health officials, and environmentalists which reviewed his report says limits aren't necessary. So now it's up to Health Canada to decide who's right. A difficult task, says the official who's drafting the policy.
If that product has been in use for many years and we discover some potential risks to it, it becomes much more difficult to reverse the trend.
Internal government documents reveal that Mark Richardson wasn't the only Health Canada researcher to sound the alarm about amalgam fillings. Concerns in the department date back 20 years, with the first study done by Dr. Pierre Blais. The Blais report concluded then that amalgam fillings are a health risk and called for guidelines. But it disappeared into the cavity of public archives.
The department ran into a very strong lobby, both from the industry that was marketing the product and from the dental practitioners, many of whom were still committed to the substance because it was easy to use.
I don't know the details of that. It was 20 years ago. In fact, I can tell you that I wasn't aware of Dr. Blais' report until it was discovered in the archives last summer when Dr. Richardson was doing his work.
The use of mercury fillings predates safety regulations. But during the 1980s, new filling formulas were required to undergo safety tests. But that law was never enforced. Was Health Canada breaking its own laws?
I don't know, and not being a legal expert, I couldn't offer an opinion on that.
I think history probably is on our side. The fact that there are no known reported instances of illness due to mercury. There are some people with some sensitivities. Perhaps 3% of the population has an allergy or some kind of sensitivity to amalgam.
Some members of the dental community are turning away from mercury.
Basically, I believe that we all have the responsibility to ask the questions about what goes in our mouth and how we want to have things done.
The white plastic fillings take longer to install, they're more expensive, but she and her patients feel it's worth it.
It shouldn't be in anybody's mouth, and I'm just really glad that it's out of mine.
No one should really fear the dentist, but after years of debate, the question remains, should we be afraid of what they fill our teeth with? All sides are now looking to the government for an answer. And 20 years after the Blais report, Health Canada says it is prepared to take a stand, with a policy statement expected in 2 months. Linda Boyle, Global News, Toronto.
Those mercury